Thousands of National Health Service staff in the United Kingdom have taken to the streets to demand better work conditions. Healthcare workers say the applause that they received across Britain during the pandemic should now be backed up by better pay and improved patient safety.
Their work has been relentless. Now NHS staff have demands of their own. Across the country, they took to the streets to say this.
What do we want? When do we want it? Now!
The message to the Prime Minister and his new Health Secretary, loud and clear.
My message is please do rethink your priorities. But if you don't, we're not going to go away quietly, and we're not going to let you get away with it.
I've worked in the NHS since 1982. I've never known a period when our staff are so exhausted, so demoralised, so badly led by the government, so let down and underpaid.
You've said that you love the NHS, and yet you've insulted the workers, the million workers, by only offering 1%, which is effectively a pay cut with inflation.
Simple, isn't it? Health before wealth.
The pandemic has made their work personal. Jordan Rivera and her team lost 3 of their colleagues to COVID, including Dr. Abdul Mabud Chowdhury, who'd warned of a lack of protective equipment.
It's like the most heartbreaking thing, especially knowing that he'd just done that appeal for proper PPE. And there have been times when we didn't have the things that we needed. And I know the hospital was really doing everything they could. You know, it's not their fault. But when you have to appeal to local schools to give us their science goggles, you know, it was just terrible situation.
Today is the first step in a chain of action for justice for our NHS.
At this rally in Nottingham, we met Maggie, who questions whether the job is still worth the pay rise they've been offered.
For the government to just offer a 1%, and we basically put our lives on the line, you know, for the last year. It's just galling, a real kick in the teeth. I'm a single mum. You know, I've still got my car payments to make, still got a mortgage to try and keep up if I can, and you know, and I've been a nurse in the NHS for 32 years. I have considered quitting.
A Department of Health spokesperson says the government has agreed to a pay uplift for NHS staff at a time when pay uplifts have been paused across the public sector to acknowledge the extraordinary effort of NHS staff during the pandemic. But for these people, the pay rise isn't enough. As the NHS marks its 73rd birthday, its workers fear what the future has in store.